And as always, welcome back. First off, I'd like to say I'm sorry I haven't posted any content in the past couple of weeks. Unfortunately, I got pretty sick with COVID and I just really haven't been up to filming anything recently. So also because I've been sick, I haven't quite finished all of the material for my next blood transfusion video. So today we're going to talk about something different. I'm hoping to get back to blood transfusion therapy next week, but for today I wanted to talk about something I've kind of been discussing with some of my teammates at work, which are the common mistakes I see with IV catheter placement. As a VTS, it is part of my role to help teach and train new technicians and TAs on phlebotomy and how to place IV catheters. So even though this is a broad topic and you're gonna get different answers to this question depending on who you ask, I wanna go over, in my opinion, the top 5 most common mistakes for IV catheter placement. I'd like to preface this by saying this is not a how to place an IV catheter guide. I will do a video on this when I have the right materials ready, but today this is just common mistakes that I see, and the hope is by hearing what some of the common mistakes are, you'll be able to refine your techniques in placing IV catheters. So diving right on into it, the 5 most common IV catheter placement mistakes. Number 5, starting too high. This one may seem a little obvious, but it's still such a common mistake that I see. Starting too high or placing too high up on the limb in the vessel. This is a problem because it really limits the number of vessels that you have to place an IV catheter in, especially for patients that are due for long hospital stays. If you make your first IV catheter placement attempt very proximal on the limb, and that doesn't go well, that vessel blows, whatever happens, and you don't have room to keep moving up, then that limb is essentially useless for that day and potentially for the next several days. Whereas if you start more distal on the limb and the catheter doesn't advance or the vessel blows, you still have the ability to move up and try to use that vessel again. Number 4, pulling the stylet backwards as opposed to feeding your catheter forwards off of the stylet. This is a common mistake for people that are just learning to place IV catheters, that have seen it done but haven't done it a lot themselves. And this is because you know that the stylet has to come off of the catheter, but you're not thinking about the fact that the catheter is being fed forward into the vessel. The stylet is not being pulled backwards out of the catheter. So if you're placing your catheter and you get your flash and you pull the stylet backwards, the only thing that's going to do is pull the stylet out of the vessel and make it harder for you to feed your catheter forwards. So once you've placed your catheter into the vessel, you should be using your finger to push the catheter forward, not using multiple fingers to pull the stylet backwards. Number 3 is kind of a broader category, and that is using the same technique for every patient. The most common mistake I see within this category is not adjusting your entrance angle. Every patient's vessels are going to be different. You are not going to use the same technique to place a catheter on a 17-year-old cat as you are on a 2-year-old intact male bulldog. That cat is going to have extremely fragile, extremely shallow vessels with not a lot of tissue above the vessel to get through. Whereas that dog is going to have tough, thick skin with deeper vessels. So you're going to have to think about your approach to the independent vessel as you're prepping and as you're looking at it. That cat is going to require an extremely shallow entrance into the vessel, an extremely shallow approach through the skin, because that cat's vessels are tiny, they're shallow, and there's not a lot of musculature or tissue above the vessel to go through. Whereas that dog is going to have thick skin, deeper vessels, and that skin is going to be hard to get through. If you use the same shallow technique on an animal with really thick skin, the only thing you're going to do is spend more time getting through the skin, which is going to be more uncomfortable for your patient. It's going to make them squirm, and it's not going to be a smooth placement for your catheter. Whereas if you note that that patient has very thick skin that's going to be harder to get through, and you use a deeper approach, a deeper angle to initially get through the skin, you can then adjust to a more shallow angle for actually putting your catheter into the vessel and feeding your catheter off of the stylet. So just remember, look at your patient, look at the vessel, take a second to think about how you're going to approach that vessel, because it's going to be different for every patient. All right, the number 2 most common mistake I see with placing IV catheters is pushing your stylet back into the catheter when you're having a difficult time feeding your catheter. So in this example, think about you have your catheter and you've placed it into the vessel, you've gotten your flash, and you've started to feed the catheter off the stylet, but something happens. You're not sure what, the catheter's not feeding, you don't know why. So you try to push your stylet back into your catheter. There's a couple of problems here. The first is that when that catheter has been fed off of the stylet and you try to push the stylet back in, that catheter has a lot of compliance to it, and it's probably curved somehow into the vessel, whereas your stylet is completely straight and firm. So more than likely you're just going to pierce through the side of your catheter, and then you have to completely start over. And that's also painful for your patient to remove that out of their skin. The other option is, even if you don't pierce through the catheter and you do manage to feed your stylet fully seated back into your catheter, there's an entire likelihood that you pierce through the opposite side of the vessel while you're doing this, which is going to make the vessel damaged. It's going to make it start to bleed perivascularly, and most likely it's going to look blown when you're looking at the vessel. So really, it's much better technique if you're having difficulty advancing your catheter to pull your catheter back up onto your stylet, as opposed to pushing your stylet back in your catheter. It's a subtle difference that's going to make your catheter placement a little bit more comfortable for your patient. All right, and the number 1 most common mistake I see when placing IV catheters is moving too fast. This is especially critical in patients that are presenting in the emergency and critical care setting. They're presenting to us often dehydrated or hypovolemic. They're presenting cold or hypotensive, or a whole variety of reasons why they may have poor peripheral blood flow. So if you're moving too fast, you're not giving the blood time to feed back up your catheter, up your stylet, to get the flash to let you know that you're in the vessel. When you've been placing catheters for a long time, you start to be able to feel your catheter pop through the vessel as you're placing it. If you start to feel that pop and you think, I feel like I'm in this vessel but I'm not getting a flash, just wait. Give it a few seconds to let the blood start to feed up that catheter, up that stylet, so that you can get your flash to let you know you're in the vessel. In some circumstances, for our very hypotensive patients or very hypovolemic or cold patients, you may not even get a flash. You have to just use your instincts. This happens a lot, especially on our really tiny, really sick parvo patients. If you feel like you popped through that vessel and you feel like you're in it, Maybe you are. Give it a couple seconds. Let that blood try to feed into the hub of your catheter to see if you're in. Or if you're not getting a flash, you can try to feed your catheter. If you're in the vessel, it should feed even if you don't get a flash. If it feeds smoothly, I will try to tape it in place with at least one piece of tape and then flush it to see if it's flushing well. Sometimes you just have to trust your instinct, trust your gut and your feeling about whether you're in that vessel. This is also the #1 mistake I see with placing central lines. Just because you're placing into a jugular vessel doesn't mean you're going to get a good flash. If that patient is sick enough to need a central line, it's probably sick enough to have poor blood flow or low blood pressure, and that flash may either be delayed or non-existent. And by moving too fast, adjusting your catheter too fast, if you're not giving yourself time to evaluate whether you're in the vessel and you pull out of it, that vessel is probably going to blow, and you're either going to need to start all over higher on that leg, or depending on what kind of attempt this is, that entire area may just be no good for placing catheters anymore. So trust yourself, go slow, and try to really feel through your fingertips what is happening with that catheter under the skin. If you pay attention, you're gonna be able to know you're in the vessel even before you get your flash. All right, so this was a short video, but top 5 most common IV catheter placement mistakes that I see. If you have any questions, any other mistakes that you find that are common, go ahead and type them down in the comments. As always, if you've made it this far, please like this video, subscribe to my channel, and I will see you again soon. Ooh, who's stopping? Don't rub on that. You guys, why? Part of my job to stop chewing on the. Stop it. Come here. Bring it back up. Even though this is a broad topic and you're going to get different. Why are you on the fish tank? Abby, what are you doing, buddy? Come here. Come here.